And so it gives me great pleasure to introduce to you and hand it over to Dr. Zafar.
So good evening. I was requested to talk about sleep and a little bit in the context of metabolism. So forgive me if there's a lag because I'm using two different computers to do the imaging. So this first image is just to explain, people often think that when you fall asleep, you simply just go to sleep. Sleep is actually an active process. The main neurotransmitter involved with sleep is actually just inhibiting all the other neurotransmitters that promote wakefulness. I'm just going to jump ahead a second. These are the neurotransmitters that keep us awake. So adrenaline, norepinephrine, epinephrine, they're in the same category. Dopamine, which is receiving a lot of attention because that's what's used for stimulants for people with ADD. It is a wake-promoting neurotransmitter. Acetylcholine, which is more involved in REM sleep, but it's also involved in maintaining alertness. Histamine, which is also very commonly known. A lot of people who take allergy medications take antihistamines. Depending on the antihistamine, it can actually cause sleepiness or sedation, and this is why, because histamine is actually a wake-promoting neurotransmitter. Glutamate and aspartate, which are not as commonly known and not something that we typically target when we're treating sleep at this time. And hypocretin. Hypocretin is actually a neurotransmitter that's involved more with the sleep-wake switch in terms of activating sleep or wake, but it is considered to be one of the neurotransmitters of wakefulness. So when we're talking about sleep, we're talking about inactivating all of these neurotransmitters. If there is upregulation of any of them, which can happen with a mood disorder, with someone who's got a hyperarousal state and has constant mind activity or racing thoughts, their noradrenaline levels, their dopamine levels tend to be a little bit higher. Histamine is typically not associated with overactive thoughts, but it can occur with food. So a lot of foods have increased levels of histamine, particularly when they're leftovers. The histamine levels tend to build up. Fermented foods tend to have more histamine, so that can have a wake-promoting effect. So sometimes the foods you choose to eat can have an impact on whether you feel sleepy or more awake in the evening hours. It depends on how quickly you break these down. So some people may bring histamine down more quickly and it won't be an issue. And for other people, because they're more vulnerable to being in a hyperaroused state, it doesn't take much extra histamine to keep them awake. So going back to that first slide, what you're seeing here is the brainstem, this whole section down here. The top part is the cortex. So this is where we have gray matter, white matter. This is where the cognitive thoughts occur. This is kind of the reptilian brain, and yet it is the reptilian brain that drives our sleep. So the neurotransmitter coming from the reptilian brain determine, excuse me for a minute, from the reptilian brain actually determine whether you will fall asleep or if you will maintain alertness because you're releasing neurotransmitters promoting wakefulness. So again, this is the brainstem. There are different sections of the brainstem that are actually releasing different neurotransmitters that go to the cortex to promote thought, activation, cognitive processes. These are also the same processes that are going to activate or inactivate the brain for sleep. So the other thing I just want to point out, because I will not have this picture later on in the same form. So this is the brainstem we've talked about. Right around here is your hypothalamus and your thalamus. The reason why this is relevant, the thalamus is actually a relay center, and that relay center transmits signals from the brainstem to the cortex. And that relay signal is also involved in releasing leptin, which is one of the neurotransmitters that Mindy will talk about more, that suppresses appetite, but it is in this same cortex relay center where ghrelin, which suppresses appetite, stimulates appetite, activates into the brain. So I will come back to this later, but I'm just asking you to recognize that the brainstem is right next to the hypothalamus, the thalamus, which is the relay center, and this center is impacted by leptin and ghrelin. in terms of appetite, which then affects metabolism. Okay. So this is just a picture showing a summary of what we would call normal sleep. There are different stages of sleep. So people will often ask, what's deep sleep? How can I get more deep sleep? Deep sleep is actually something we only have 15% of the night. I think the Fitbits and a lot of the devices that people are using, I'm not sure if they're really looking at this as slow wave sleep. They will break things down into deep sleep, light sleep, and I think they look at wake and REM as well. I'm not sure how some of them make those assessments, and I'm not sure how accurate all of them are. There are some apps that I think are more accurate because they're using heart rate variability to define the breathing events. However, what I tell my patients when they're looking at those is use that as a way of gauging how well you're sleeping on a night-to-night basis as a comparative purpose, but just recognize it may not be completely accurate. If you were to have an in-lab study where we're looking at brainwave activity, we may see a different pattern than what's showing up on your Fitbit or on whatever app or device you're looking at to measure your sleep quality. So coming back to this picture, this is the hours of sleep. So this would be at the start here. The 0 point is where you would fall asleep. And the end point here is assuming you were in bed for 8 hours. The stages are listed here. 3 and 4 for all essential purposes are the same. This is slow wave sleep. Stage 2 is where we spend the most of the night, about 50 to 60% in adult. Slow wave sleep, like I said, it's usually 10, maybe 15%, but not more than that. Stage 1 is usually less than 10%. It's a transition sleep from wake into sleep. And then rapid eye movement or dream sleep, which is the red, is what we're seeing up here. That's usually about 20% of the night. All right. The purpose of sleep, there are many purposes. I'm just listing a few here. Adequate sleep is extremely important. It reduces heart rate. It reduces blood pressure. It's downtime for the body to clear toxins. So it's actually during sleep that the brain gets rid of toxins through its lymphatic system. So you don't get rid of toxins in the brain while you're awake. It's occurring during sleep. So the more sleep you get, really the greater the chance that your body will have to clear toxins and waste that's kind of been resting in the brain while we were awake. It also decreases inflammatory markers. In theory, when you're sleeping, there's upregulation of markers that decrease body inflammation and help with repair and recovery. And while I put down downtime for the brain, I'm again going to say there are periods of time when you're sleeping where the brain is actually more active than it is when you're awake. That's primarily when you're in dream sleep. And there is a necessity of that in terms of integrating information, processing emotions. But downtime is a relative term. It's not like your brain is asleep and it's not doing anything. It's fairly active. So this slide is just giving a summary of the more we sleep, the more alert we are. Now, everybody's different in terms of the amount of sleep they need. This is a generalization, but obviously the longer you sleep, the more awake you are. So hours of sleep are on the x-axis, and on the y-axis is a measurement of mean sleep latency, which is how quickly it takes someone to fall asleep if they're given the opportunity to take a nap during the day. And the more you sleep, the less likely or the longer it will take for you to fall asleep during those naps. So there are two things that drive how much we sleep. It's how long we've been awake and how much sleep we have, and where we are in terms of our biology. There's a circadian rhythm that drives our need to sleep, and how long we've been awake is another factor that drives how much we want to sleep. So early on, this is 8 a.m., and then we're going across this way to 12 midnight. The greatest alertness is about 2 to 3 hours after you've woken up. And then as the day progresses after that, you can see that there's a gradual decline in alertness, which is also reflective of a greater drive to sleep. This is another thing which I just mentioned before, which is circadian rhythm. So circadian rhythm is the biology of what drives us to sleep. So there's a function of how long we've been awake, but there's also the biology. There's certain times in a 24-hour cycle where there's a stronger drive to sleep, and that can be measured by core body temperature. So the lower the body temperature, the more awake you are. The higher the body temperature, the more sleepy the body is. So if you look, sorry, I've got two computers here and it's getting a little confusing. Here, where the core body temperature is the lowest, is around 9 or 10 o'clock in the morning. So as long as you got enough sleep, assuming you got 6 to 7 hours, if not 8 hours of sleep, the drive to sleep is diminished. But if you, and so then this graph would be accurate. The greatest level of alertness when people wake up around 6 or 7 o'clock in the morning would be around 9 or 10 o'clock in the morning. Core body temperature is the lowest. Then as the day progresses, the core body temperature starts to increase and the body's drive to sleep increases. Now this is a little bit of an oversimplification because typically the strongest drive to sleep from a circadian standpoint is between 4 and 6 o'clock in the morning. So this is around this period of time for the core body temperature. There is also another period of time people will think about in terms of a siesta. In the Middle East also, there's a strong drive to nap in the afternoon hours and after lunch. So it's usually somewhere between 1 and 4 p.m. And there's also a dip in the temperature at that time, which you can kind of see over here. It's just, it's starting to rise. The temperature is starting to rise, but it hasn't maximized. You can see that these two temperatures are kind of similar. The one between 3 and 4 o'clock in the morning here, and the one here around 1 or 2 o'clock in the afternoon. Melatonin, which is often used to promote sleep. It's a very common over-the-counter supplement that people will use to sleep. Its function for sleep is purely to tell the body to shift to dark cycle activities. And so what you're seeing here, the dim light melatonin onset typically occurs about 4 to 5 hours before the target bedtime, usually around 5 o'clock or 6 o'clock in the evening, depending on the person's biology, which is around here. And then it tells the body to start shifting to dark cycle activities. So within 4 to 5 hours, people will typically start feeling sleepy and getting ready to bed. That's assuming there are no other things to prevent the person from falling asleep. Electronics is one of the biggest causes of insomnia. It actually offsets the effect of melatonin. And as a result of that, people will have trouble falling asleep even if they're taking melatonin. So something to keep in mind is if you're doing a lot of electronics or light exposure in the evening, it can affect your body's response to endogenous or the melatonin it's making itself internally. And so that might be one of the reasons why people respond to melatonin, because their own levels of melatonin are low and offset by light exposure and electronic exposure during the day, during the evening. So the one thing I want to comment in terms of circadian rhythm and mood and depression is seasonal affective disorder, which is something that's fairly common. So people will often find that they have more energy, more alertness. They're more active and they sleep better in the summer months, and in the winter months, they may find that they are reported, they may sleep well at night, but they may also be finding that their mood is less, they're more tired, they may want to sleep longer because they're not getting as much light exposure. So just like light suppresses melatonin, insufficient light can promote melatonin on some level, resulting in symptoms of fatigue. So in the winter hours where it's dark longer, some people actually are very sensitive to that and their mood can decline. So the sleep quality can also change as a function of that. So we had already talked about alertness and the body temperature. I'm not going to repeat that. This slide is extremely interesting. So remember when we had started, and just as a refresher, if there were people who had problems, just coming back to this again, we had talked about the brainstem, the hypothalamus. Now coming back to that slide, you can see that here we have the dorsal, this is all parts of the hypothalamus, dorsal medial. Let me just keep it simple. This is all parts of the hypothalamus. This part over here is, the SCN is a suprachiasmatic nucleus. This is where the body sets its time in response to light exposure. This is what triggers melatonin production as well. The SCN sends a message to a different part of the brain to start releasing melatonin. But this is also called the body's clock. So that you can see there's a connection here between your brainstem, which is lower down, your hypothalamus, and then the body clock, which is setting time for the entire body for different functions. This is also part of the hypothalamus here. Leptin actually is triggering or acting on this part of the hypothalamus, which can then affect the body clock. Ghrelin is also coming from the stomach, and it's also activating the hypothalamus through a separate nucleus. I'm just going to leave it as ARC. There's a full name for that. But you can see that the hypothalamus is also involved with feeding. Orexin is a wake-promoting neurotransmitter. Glutamate we had talked about earlier as a wake-promoting transmitter. So not only is it promoting wakefulness, but if we look at ourselves as a basic mammal, so taking out the cortical function for a while, we're looking at the reptilian brain or the basic brainstem. These are the basic functions of life. So it's feeding, appetite, sleep, and safety. So the other thing I want to just point out here is corticosteroid release. This will go on to impact cortisol. Cortisol is involved in setting metabolism. It's also linked to insulin. So signals coming from the hypothalamus will impact metabolism and including insulin through different parts of the hypothalamus, different sections of the hypothalamus. And the signals coming from the body will then affect how the hypothalamus releases things as well. So it's a bi-directional relationship, which has an impact on metabolism, which can then go on to also impact diabetes. I know that Mindy's going to talk about this greater. I'm just showing here. When we deprive our sleep, decrease our total sleep duration, we will actually increase our ghrelin levels. The more tired you are, the more ghrelin your body produces, the hungrier you will feel, the more the body is getting messages that I need food. So sleep deprivation in and of itself does several things. It increases our stress levels. If I get 4 to 5 hours of sleep, my body is more stressed. My heart rate goes up, my blood pressure goes up in the morning. That stress is also going to affect cortisol, which is the stress hormone produced by the adrenals. And cortisol has a connection with insulin. So if I'm stressed, my cortisol level goes up, my insulin level will go up as well. Both cortisol and insulin decrease metabolism. So I'm sleeping less, I'm more stressed, and my metabolism is going down, but I'm hungrier. So you can see how that combination can lead to a lot of weight gain in a susceptible individual. And that may not be an issue when you're young, but this can have a cumulative effect. And at some point there's a tipping point. And now you find that, you know, I always went by on 5 or 6 hours of sleep. Well, now it's an issue because you're eating more, whether you're aware of it or not. And even if you're not eating more, because from a cortical level, you're making a conscious effort not to eat too much, your metabolism has shifted. Your cortisol and your insulin levels are elevated. They're not going to suddenly go down just because you're restricting your food intake. Your body is now saying, I need to conserve energy. Metabolism decreases. So even for the food you're eating, you can't lose the weight or you're gaining weight. And I think many of us experience that. And again, this is a simplification because there are other factors as well in terms of things that are coming through plastics and the endocrine modifications that occur with that. But I just want you to understand that sleep deprivation can have a significant impact on metabolism and the ability to lose weight. The only things I want to point out here is, again, we talked about circadian rhythm and body clock. There's it's a little bit longer than a 24-hour cycle, but I'm just going to simplify it and say 24 hours. There are different areas of the body that are active at different times of the day. And what I want to point out here is this is more based on, and when I talk to my patients about this, I do this based on the meridian system and in Chinese medicine. So if you look at the meridian system, it's an organ for a 24-hour cycle for the body. And if you look at where the adrenals recover, and that's where adrenals are the organ that responds to stress. That's the one that releases cortisol. That occurs between 9 and 11 o'clock in the evening in most individuals. Just looking, and again, I'm referring to the meridian cycle from the Chinese medicine. This is not based on stuff from allopathic medicine, but it makes sense. We recognize in allopathic medicine that there's a 24-hour cycle. There are different organs that are recovering at different times. The liver tends to regenerate and recover usually between 2 and 4 p.m. So people waking up at that time might have a liver imbalance. Addressing that, helping clear liver toxicity can actually improve sleep in that regard. Mind activity is a separate issue. I'm just talking about the Chinese medicine part of this, but the adrenals are between 9 and 11 o'clock. So early sleep can be very powerful in terms of helping the adrenals recover. If you're wide awake, watching television, playing video games, engaged in physical activity while your adrenals are trying to recover, it can be a little counterintuitive because you're sending energy in two different directions, and we only have a limited amount of energy. So if you find particularly you've been under a lot of stress, earlier bedtime can be very powerful. And I think this might be part of where that concept came from. Benjamin Franklin's statement of early to bed, early to rise makes a man healthy, wealthy, and wise. There is an impact in terms of when you sleep and when your organs recover. All right. I'm not going to go into this. Shift workers, obviously, often they will have less sleep because they're working at night, and then during the day, they are being asked to do a lot of daytime activities. As a result of that, they get less sleep, which can have an impact on the other things we just discussed earlier. But this is rotating daytime shift. So fixed daytime schedule, people are averaging 7 hours of sleep, or between 6 to 7. You do a rotating schedule, they're still averaging somewhere between 6 to 7. But if you're on a fixed night shift, you can see that they're averaging around 5.5 to 6 hours of sleep. And that can have an impact on the other factors we were talking about. Hypersomnia and insomnia. So talking about sleep disorders. So we've talked about sleep, the importance of sleep. There is not getting enough sleep because you're actively too busy and don't have enough time to sleep, and that seems to be the easiest thing to compromise. But there are people who are getting enough sleep. They're sleeping 6 to 8 hours, and they still have issues. So if we're talking about sleep disorders in that context, one would be being sleepy during the day, tired, wanting to nap, and the other would be insomnia, where you feel you can't sleep, you're waking up frequently, you're having trouble getting back to sleep. So you can break sleep disorders into two very simple concepts. Either you're sleepy during the day or you're not able to sleep at night. Both of those can have an impact on total sleep hours, sleep quality, which can then have an impact on metabolism and other organ dysfunction. So napping, which can be a marker of not having slept well the night before or not having good quality sleep. You might have gotten 10 hours of sleep, but people who say I can fall asleep anywhere, anytime, they have a sleep issue. If you're getting 8 hours of sleep, it's not normal to then want to nap during the day. So this is just examples of different sleep, different issues that can affect sleep quality and then lead to napping during the day. Nocturia is waking up at night to use the bathroom. Body pain, which is self-explanatory as well. So people who wake up to use the bathroom tend to nap more frequently. People who have pain disrupting sleep tend to nap more frequently. People who are depressed. Now, they may actually be sleeping well, but they also have a tendency to sleep more. Now, this can be a function more of neurotransmitter imbalance. We talked about some of those early on. If there is an imbalance or a depletion of some of the wake-promoting neurotransmitters during the day with depression, you can see people who feel more sleepy. And then comorbid illnesses, this is lumped in with heart attack, heart failure, underlying lung disease, asthma, COPD, and a host of other things, autoimmune disorders, which could go into body pain too in terms of physical discomfort. But this is just lumping all the other diseases in. But you can see there's a significant increased incidence of napping when people have other illnesses present, including diabetes. And often diabetic patients wake up at night to use the bathroom. I'm going to go quickly. I'm not going to go through all these slides. I just want to talk a little bit about restless leg syndrome, which is often present in patients with diabetes. So restless leg symptoms is classically presented as people who have leg discomfort. It's worse in the evening hours. It gets better with movement. So if it's in the evening, it occurs when you're resting, it gets worse If you sit still, it gets better if you move. Typically, it's not present during the day, but there are people who will have it during the day. If they're sitting in the office chair for a long period of time, in a movie theater, in a car, they may have these symptoms, but they are going to be worse in the evening. Often they will prolong sleep onset. Typically, people experience them in front of the television. It increases with age. It is associated with, it says here, iron storage deficiency, which is ferritin. A ferritin level less than 50 can be associated with restless leg syndrome. The thought process behind that is that ferritin is necessary for the body to make its dopamine. So if you don't have enough ferritin, you don't make enough dopamine. Dopamine insufficiency can lead to issues with wakefulness during the day, but it can also lead to hyperkinetic behavior and restless leg symptoms. It can be associated with high blood pressure and heart disease. So the incidence increases. So this is age. As we get older, the incidence of restless leg symptoms increases. It is higher in patients with diabetes. So diabetes and restless leg syndrome, 27% of patients with diabetes have restless leg symptoms with sleepiness and reduced sleep quality. All right. The impact, it can cause drowsiness. So people who are at risk for restless leg symptoms are the light blue. So you can see the light blue goes out the furthest. This is the percent of people having the issue. And you can see in all of these, light blue, people who have RLS or at risk for RLS clearly are more drowsy when driving, have more errors at work, miss work or miss other events, social events. They're late for work and they report feeling tired. Fatigue is the most common symptom. This is what I was talking about with the ferritin. Patients who have low ferritin levels below 50, there's a higher incidence of restless legs. So the average level of ferritin for a restless leg symptom patient was 33, and it was 59 for someone who reported no issue with restless leg symptoms. So sleep apnea is another cause of daytime sleepiness and sleep fragmentation. It definitely has an impact on quality of life, which is what you're seeing here. Light blue is the general population. Yellow is our patients with obstructive sleep apnea, hypopnea. And the pink, just for comparison purposes, is Parkinson's. So the only disease that can have a greater impact on quality of life is the Parkinson's. But sleep apnea, which is the yellow, the lower down you are, the more you're impacted. The higher up you are, the less you're impacted. Better quality of life, higher up on this axis, lower quality of life, lower down on the axis. You can see consistently Parkinson's frequently has the greatest impact, but sleep apnea is fairly similar and following the same trend. So there's a greater incidence of mental health issues. People are more emotional with untreated sleep apnea. Their general health is a little bit less. They are not as their physical stamina and endurance is not the same. So with sleep apnea, I think we already talked about this a little bit before, but when you are not getting enough sleep, and sleep apnea is a form of sleep fragmentation, just like restless leg symptoms, you will see downregulation of leptin, which is supposed to suppress appetite, and upregulation of ghrelin, which stimulates appetite. So patients with sleep apnea have metabolic imbalance in part because of alteration in the leptin and ghrelin levels, which are driving or suppressing appetite, and that can impact weight loss. So this slide is just showing in patients who have obstructive sleep apnea, hypopnea, their leptin, even if the levels are higher, which is what this would indicate, it doesn't work as well. Okay. Sleep apnea is more likely to occur in diabetic patients. So this is mild sleep apnea, moderate sleep apnea, severe sleep apnea. So both oranges are severe, moderate is blue, mild is yellow. Patients who are sleepy with severe sleep apnea have a greater odds of developing diabetes. It would be 2.6% is the odds of developing it. The odds ratio is you're more likely to develop it, 2.6 times more likely to develop it if you're sleepy and have severe sleep apnea to develop diabetes, as opposed to 1 time more likely if you have severe sleep apnea and you're not sleepy, suggesting that it's not just the sleep apnea. There are other factors in patients who have sleep apnea and are sleepy that increases or affects their metabolism, as opposed to people who have sleep apnea are not sleepy. Their metabolic shifts are different. It's a different expression. Hemoglobin A1C, just to show in untreated severe sleep apnea, even if they're being treated for their blood sugars, you can see that their hemoglobin A1C is higher at 9.5 for severe sleep apnea, 7.5 for, a little bit above 7.5 for moderate sleep apnea, and about 7.5 for mild sleep apnea. Someone without sleep apnea, their hemoglobin A1C, the average is much less at 5.5. Insulin resistance with untreated severe sleep apnea. Again, the diabetic patients are insulin resistant. They need more insulin to manage their blood sugars. And on the bottom here, the greater the frequency of breathing events, this is 20, 40, 60 breathing difficulties an hour, the higher the plasma, the baseline insulin level is resting in the body. And this is relevant because if my insulin level is high at rest before I've even eaten, my metabolism is slower, weight loss is more challenging. I'm going to end on this slide. This is just to show that advanced glycolation is glycosylation on the blood sugars. This is part of how they measure long-term blood sugar control with the hemoglobin A1C. So the kinds of foods you eat will have an impact on glycogen binding onto the hemoglobin molecule, which increases its vulnerability to clotting. It affects its ability to, results in its ability to clump more and form plaques in the blood vessels, which leads to heart disease or vascular disease, depending on where you're looking. So not only is elevated blood sugars and insulin resistance going to increase glycosylation, which affects the cell function and our overall health, not only is it the foods we eat, but also changes in oxygen level as a function of untreated sleep apnea can also increase the glycosylation of the blood cells, which then leads to disease and illness. And I am going to end at this in the interest of time. Thank you.
Well, thank you, Dr. Zafar. That was chock full of information.
Thank you.
And great facts. Greatly appreciate it. And I'd like to now introduce you to our next presenter, Mindy Komosinsky.
Thank you. And let me just share my slides. Okay. Thank you for joining us for our sleep, nutrition, and diabetes program. When talking with my patients, when I do my outpatient nutrition counseling, I often ask them about how they are sleeping, and some likely think, what does that have to do with nutrition? But as you just learned in the previous presentation, that it has a lot. Our sleep patterns are very linked to our nutrition and our eating habits. And for many people, getting a good night's sleep doesn't come easily, right? Balancing life, including home and work responsibilities, leisure activities, and social activities, can cause people to not get enough sleep. Many people also experience irregular sleep patterns, like those that work during the night time hours. And there are also those who suffer from sleep disorders, as we just talked about, such as insomnia and sleep apnea. I think that sleep problems are often an under-recognized factor in diabetes and in weight management. So I'm happy to have this discussion with you tonight. We will discuss how sleep can affect your diabetes, how sleep can influence your eating habits and weight, and how to improve your sleep and diabetes. And first, I would just like to say, if I can put everyone to sleep within the first 3 minutes, the rest of my presentation should go pretty well. But all kidding aside, I hope you will stay awake with me tonight. So let's get started. And I think for a long time, people thought that sleep was only important for their brain and their mind, which is true. Sleep is very important for our brain. Adequate sleep can help us to feel more refreshed, help us to concentrate better, decrease stress and depression. Many of us have felt the effect of lack of sleep on how we feel during the day. Now we know that sleep is not only important for our brain, but it is also very important for the body. Here is a list of some of the ways that a lack of sleep can affect your body. It can increase insulin resistance, increase the risk of diabetes, increase our appetite, make it harder to lose weight, raise blood pressure, increase our risk of a heart attack, make your immune system less able to fight infections, and increase your risk of depression and anxiety. So even if you feel that you can tolerate the brain effects of sleep deprivation, chances are that you may not be able to tolerate the metabolic consequences on your body. I'm going to focus tonight on how sleep is related to our eating habits and diabetes management. So first, let's just talk about how sleep can affect how we eat. Our bodies produce the hormones ghrelin and leptin. These hormones influence our appetite, and they influence our hunger and fullness cues. So ghrelin is produced in the stomach. It's sometimes referred to as the hunger hormone because it stimulates the appetite. In other words, it tells you when to eat. Leptin is produced in the fat cells. It sends a signal to your brain when you are full. In other words, it tells you to stop eating. It is considered the stop eating hormone. Okay. And I thought this slide that was side by side was helpful. So when you do not sleep well, let me get my little pointer going here too. Okay. So when you do not sleep well or you do not get enough sleep, your body releases more ghrelin, the hunger hormone, which increases your appetite, so you end up eating more. Also, when you do not get enough sleep, leptin levels decrease. Remember, leptin is the stop eating hormone. So you do not get the signal to stop eating, so you end up eating more. So when your ghrelin is high and your leptin is low, it's hard to stop eating. Take a look at this photo I have here with the mice. So the large mouse on the left side of this photo is a lab mouse, and he is not able to produce the hormone leptin. So he kept eating and he grew large. And this is one of the reasons why people tend to gain weight when they do not get adequate sleep. This is also one of the reasons that it's so difficult to lose weight when people go on a weight loss diet and they lose body fat. Leptin levels fall. Remember, the leptin is produced by the fat cells. So when they lose body fat, lose weight, leptin levels fall, which increases your appetite, right? Increases your appetite and you eat more, which is why it really isn't that you're lacking willpower. It's hard to win a fight against leptin. Decreased leptin can make you very hungry. Also, lack of sleep often means extra time awake, which increases your opportunities to eat, especially if you stay up at night. Or some people get out of bed during the night hours and end up having a snack or a meal. Sleeping less, inadequate sleep, may disrupt circadian rhythms, which is the body's internal clock, which can also lead to weight gain. Some research has actually shown that if you are a 5-hour a night sleeper and you start to sleep for 7 hours a night, you may actually start losing weight. And studies have shown that when you are sleep deprived, you are more likely to eat an extra 250 to 385 calories a day. On a personal note, I find when I stay up too late because I'm doing work or watching TV, I often get hungry again, say at around 11:30, because that is about 4 hours from when I ate my dinner. But when I get myself into bed, say at 10, when I really should, I don't get hungry again. And so I always say it's a win-win, more sleep and less eating when I really should be sleeping. So just think about your current eating habits. That's what I always say, is hopefully you'll see some, maybe correlations or areas that you would like to focus on. Also, when we are sleep deprived, it often leads to us feeling low on energy. We don't have the energy to be active or the desire to prepare our own meals. So you're more likely to get takeout or grab quick snacks and comfort foods, which often tend to be high in carbs and calories. So the end result of these factors is often weight gain and also blood glucose spikes. So to kind of sum that up, inadequate or poor sleep can make you hungrier the next day, reduce how full you are feeling after eating, make you more likely to reach for junk food, and all these can make it harder to lose weight. Let's now talk about insulin resistance. Excess weight, an inactive lifestyle, and inadequate sleep are all associated with insulin resistance. Insulin resistance occurs when people have built up a tolerance to insulin, making the hormone less effective. At first, the pancreas compensates by secreting more insulin, but over time, the pancreas gets kind of tired, right? And it's unable to keep making that extra insulin. So that picture right there, right here, whoops, that is a tired pancreas. And when the body is no longer able to produce enough insulin to keep blood glucose in the healthy range, prediabetes and type 2 diabetes develops. And since the A1C reflects your 3-month blood glucose level, that goes up as well. And as I mentioned, the doctor mentioned, sleep problems appear to play a role in developing insulin resistance and diabetes. And also individuals with diabetes have a higher chance of developing sleep disorders, such as sleep apnea, restless leg syndrome, and insomnia. It really goes both ways. Now, this is the sleep apnea fairy. And she says, I'm the apnea fairy. I have orders to give you a wake-up call at 10:30, 10:47, 10:53, 11:02, and so on. So, and there's another way that disturbed sleep can have an effect on your diabetes management. If you experience disturbed sleep, you may be less likely to follow other diabetes self-care behaviors, such as getting enough exercise, doing your meal planning, and monitoring your blood glucose levels. When we are not well rested, it's hard to do these activities. So you can see there's several reasons why sleep is so important and how it can affect our diabetes, weight, and eating habits. So as I stated in the introduction, sleep does not come easily to some. For example, if you have young children that wake up during the night, or if you are required to work night shift hours, or if you suffer from insomnia or other sleep disorders, these can make getting a good night's sleep very difficult. However, there are many of us that are sleep deprived by choice, meaning we do not prioritize sleep like we should. Instead, we tend to be on our smartphones or other electronic devices much of the night, or we're binge watching TV shows or movies, or we're just too busy or stressed and we cannot shut our brains off. So try your best to prioritize sleep. I know it's hard. I know it's a struggle for myself as well sometimes, but it can make you, but if you make a few changes and improve your sleep routine, you may see the benefits with your diabetes, weight, and energy levels. And generally, it's recommended to aim for that 7 to 9 hours of sleep per night. So aim for at least 7 hours. Usually they say over that is actually not healthy as well. So I'll just review some of the sleep hygiene tips, the ones that I think are really important. First one being mentally unwind and relax before bedtime. Come up with a routine that works for you, that gets you ready for bed, maybe a shower. Reading tends to make the eyelids, I think, heavy. Writing in a journal, especially if you do have stresses, they say writing in a journal can really help get it off your mind on paper so you can deal with it the next day. Turn off or remove electronic devices such as TVs, computers, phones. Again, we just talked about the light that they emit that can interfere with your circadian rhythm and your sleep cycle. Keep your bedroom dark, quiet, relaxing, and cool are the keys. You may need to wear earplugs if you have a partner that snores and disturbs your sleep. You may need to cover up your digital alarm clock or other things that might be giving off some light during the night. Or wear an eye mask to keep it dark. Or if you work the night shift, you might even want to invest in room darkening shades. I just spoke to a client recently who works the night shift, and he said that it was the best investment was getting room darkening shades or curtains. If your mind gets active when your head hits the pillow, it's oftentimes we start thinking and worrying about things. I really recommend trying box breathing. That's what this picture is here, showing the box breathing. And basically what you do is you breathe in slowly while counting to 4, hold that for a count of 4, breathe out for a count of 4, and then hold that for a count of 4. And you just keep doing this over and over and over again until you fall asleep. I really find that the breathing, it helps to relax you, and the counting helps to stop your brain from thinking about stuff. Kind of like when we learned as children to count sheep, which always kind of threw me off. I like the box breathing better. To be honest with you, sometimes I don't even do the full box. Sometimes I just count slowly 1, 2, 3, 4, and slowly out 1, 2, 3, 4, over and over again. And I really find it helps me to sleep. I wish I knew about it in high school. So there's just some strategies for sleep hygiene. I found a lot of sleep comics that I just had to include. This comic says, I had to quit drinking coffee. It keeps me awake during presentations. I hope you're still awake with me tonight. I know it's getting late. But I will talk next about some food-related sleep hygiene tips. First, let's talk about a few things to avoid. Caffeine has different effects on people. Caffeine's effects can last for 8 hours or sometimes more. Most recommendations are to avoid caffeine for 5 to 8 hours. Some even say 10 hours before going to bed. So you kind of have to learn yourself what works best. But caffeine is in coffee, tea, some sodas, energy drinks, chocolates, and even some medications. Decaf versions should be okay of coffee or tea. I actually find sometimes drinking a cup of tea in the evening can be very relaxing and help induce sleep, an herbal type tea. So even if you're the type of person that can fall asleep after drinking a beverage with caffeine, caffeine in the afternoon and evening can prevent you from entering those deep restorative phases of sleep. Alcohol. Many people say that alcohol helps them to fall asleep, and I believe that it can, but it does disrupt normal sleep patterns. It keeps you from entering those deeper stages of sleep, and it may leave you feeling tired the next day. Liquids. Limit or avoid liquids for at least 90 minutes before bedtime, especially if you wake up during the night. If your sleep is disrupted by waking up to use the bathroom, you will not have as good of a restful sleep. So try to drink more water earlier in the day and throughout the day. I find when I do not drink enough during the day, I get very thirsty in the evening, and then I'm drinking a ton, and then it could be a problem with the nighttime bathroom trips. Okay. Heavy meals. They're likely to make you feel uncomfortably full. So avoid eating heavy meals for 2 to 3 hours before bedtime. When you eat a large meal, your body is working overtime to digest it. It also may worsen heartburn and GERD if you're prone to that. GERD is gastroesophageal reflux disease, which is when stomach acids and the food and fluids flow back into the esophagus and cause heartburn, which tends to be worse when people lay down for the nighttime. Okay. I know we talked about how staying up late can lead to increased eating at night and how it's best to go to sleep earlier to prevent the eating that we do in the evening. However, if there's a long time between when you eat dinner and when you go to bed, or if you're hungry before you go to bed, then a properly constructed light snack may help you to sleep. If your stomach is growling in bed, you will not be able to fall asleep easily. So a light snack will take the edge off your hunger. And if you include a small amount of carbohydrate food and a small amount of protein, that makes a great combination. The protein will help slow down how quickly the carbs are digested and absorbed. So this will keep your blood sugar from spiking, keep it a little flatter. And protein contains the amino acid tryptophan, which helps the brain produce the calming hormone serotonin, which helps induce sleep. Here are some examples of nutritious snacks that combine protein with carbs, and they might help you with sleep. Whole grain bread spread with a little peanut butter, crackers and cheese cubes or cheese stick, like a string cheese, cottage cheese and fruit, an apple or half a banana with peanut butter, or other nut butters, fruit and cheese, or fruit and nuts, Greek yogurt with berries also. I've read that cherries help with sleep, so you can pair that also with some protein. Okay. I wanted to talk a little bit about shift work, since so many people work a variety of shifts, including healthcare workers, warehouse workers, police, firefighters, and so on. Shift work, as we talked about, disrupts the body's natural circadian rhythm, which is our internal body clock. And it occurs on a 24-hour cycle. It's key to our natural daylight and darkness. And the circadian rhythm affects how the body functions, including our metabolism, digestion, and hormonal balance. Therefore, shift work can disrupt these functions. Our bodies really were designed for us to eat during the day when it is light and sleep at night when it is dark. Night shift work is a risk factor for type 2 diabetes. Some tips. It's best to avoid late night caffeine. Instead, drink before your shift or early during your shift. Try to do some planning and bring food from home and include protein, carbs, fruits, and vegetables. Get a nice balance. Eat smaller portions. Avoid heavy, fatty, or spicy foods. Shift work can interfere with your body's regular digestive routine, so heavy meals may upset your stomach or give you heartburn. Large meals also might make you feel more tired. And instead of the large meals, plan a couple of quick, healthy snacks during your shift rather than a big meal. These are some meal timing tips for shift workers. Avoid eating or reduce food intake between midnight and 6 a.m. So have something to eat before that 12 to 6 a.m. time when we really should be fasting or eating very lightly during that time if you do get hungry. Try to use the normal day and night pattern of meal planning as much as possible. So eat a small snack before you go down for your main sleep of the day to avoid waking up due to hunger. Avoid large meals 1 to 2 hours before that main sleeping episode, which basically means try to do most of your eating during the day, light hours, except for when you are sleeping, of course. And your larger meal is probably best to have after you wake up in the late afternoon or early evening. Okay. And people's work and sleep hours are likely to be different, so it really does need to be individualized. And here are just some more snack and mini meal ideas that pair carbohydrate with protein to keep your blood sugar steady and to not overwhelm your digestion during the night. But these are snacks that I recommend for people with diabetes or non-diabetes, just for when they need something to hold them from one meal to the next, and it should keep blood sugar steady. So good protein choices to keep on hand include things like nuts, nut butter, hard-boiled eggs, cheese, cottage cheese, sliced meat, hummus, Greek yogurt, which has more protein than regular yogurt. And then pair these proteins with fruit, whole grains like crackers, bread, waffles, cereal, tortilla chips, graham crackers. If you keep vegetables cut up and ready to go on hand, you'll be more likely to take them for a snack as well. And I just wanted to give you some visuals of these pairings too, because you can mix and match any of them. You know, you can have your graham crackers with peanut butter, or you can have your eggs with crackers or bread. You can really mix these up any way you like them. And the goal really is to have some carbs, those are the foods on the left, with some protein foods, which would be those on the right. I have some other examples here. You know, fruits go great with different nuts, different nut butters, cheeses. So just mix and match, and you can come up with many combinations. Hopefully you'll find some that you like, and you can add them to your shopping list and kind of plan them ahead of time. Okay. And don't forget about, again, the raw vegetables, sometimes sweet peppers or baby carrots, celery. If you keep them cut up and take them with you, you're more likely to have them. I think it's always about balance. So sometimes when I want something crisp and crunchy like tortilla chips, I'll try to have them with some vegetables and with a protein food as well. Greek yogurt, I think, tastes great with some berries and with some sliced almonds, maybe even just a little sprinkling of granola. It's all about balance. Portioning your food for snacks can also be really helpful. So use small containers or bags. When you eat portion ahead of time, it usually helps to avoid us with sitting down with a whole box or a whole bag. Okay, let's shift. I wanted to talk a little bit about high blood glucose in the morning. Okay, because have you ever been surprised when you go to bed and your blood glucose reading is in the normal range? Let's say it's 110, but when you wake up in the morning, it has shot up to say 150 or maybe even higher. Why does this happen? There's a few possibilities. So the first step is to try to find the clues. Try to play detective and find the reason why. If you have a pattern of frequent high blood glucose in the morning, it can be helpful to check your blood glucose levels before you go to bed, in the middle of the night, and first thing when you wake. If you use a continuous glucose monitor, CGM, you can sleep through the night and it'll gather all the data that you need. And if you don't use a CGM, you can see if your doctor can provide you one as a temporary loaner. They do that and can be very helpful for this reason. Your readings that you obtain from doing these tests will tell you and your doctor when your highs and lows occur so that they can help narrow the cause of the problem and treat it appropriately. So first, if you have high glucose before you go to sleep, that elevated level can persist for some until the morning, especially if you have a large dinner or a snack at bedtime, can sometimes cause that elevated blood glucose level that lasts through the night. If you are on insulin, it could also be due to too low a dose of insulin with your evening meal. Okay, so I would say always, try adjusting what you eat, how much you eat, and when you eat, and then also discuss adjusting your medication with your doctor to see if that's needed. So that's why keeping it good information and testing blood sugars can be so helpful. Now, but say your blood glucose is within the normal range when you go to bed, but when you wake up, it's high between 3 to 8 a.m. in the morning. Okay, then the cause is likely related to the dawn phenomenon. Okay, and the dawn phenomenon occurs when hormones such as cortisol and growth hormone, they begin to increase in the early morning hours between 3 a.m. and 8 a.m. They signal the liver to produce glucose, which gives your body the energy it needs to wake up and to start your day. This boost of glucose increases your blood sugar. This happens in all people, actually, with diabetes and without diabetes. It happens as a result of the body's natural circadian rhythm and hormones. In people without diabetes, insulin levels will increase, and so they do not experience the high blood glucose level in the morning. But if you have diabetes, your pancreas cannot produce enough insulin to match that early morning rise in your blood sugar, or the insulin is not as effective as it should be. Remember, insulin resistance. And so blood sugars rise around the time that you'll be waking up. And I think just to understand how blood sugars can rise overnight without you eating anything, it's helpful just to look at where glucose comes from and where it goes while we sleep. So during the day, the carbohydrates we eat are digested into glucose and absorbed into our bloodstream. From there, insulin helps the sugar get into the cells of your body to be used for energy. But some of the glucose gets transported to the liver, where it's stored for later use. The liver is supposed to release small amounts of glucose into your bloodstream when you are not eating, such as during the night, right, when we're asleep. Think of the liver as our glucose warehouse that keeps us supplied overnight while we sleep until we eat breakfast. Now, normally insulin works as a messenger to tell the liver to stop releasing sugar into the blood. However, if there's not enough insulin, such as with diabetes, the liver may dump more glucose that is needed into the bloodstream. And this can cause that high blood glucose in the morning. Okay. So in the morning, while your hormones are causing a natural rise in blood glucose, your liver is releasing even more sugar into your system, and insulin resistance prevents your muscles and your fat cells from using the sugar, and therefore your blood glucose levels rise. Okay. So there's some strategies that we can do that might help to prevent dawn phenomenon. One is try eating a small snack with less carbs and more protein. This can sometimes be helpful. You really need to experiment, see if this helps or not. Snacks at night. Some people do better when they don't eat any carbs right before bed. Some find if they have a little bit of carbs with the protein with it, that might help their blood sugars in the morning. Another strategy is physical activity in the morning can be helpful for people that experience that dawn phenomena. It can help burn that extra blood glucose. And the other option is to, talk to your doctor about adjusting your medication dosage or time. Metformin, I'm sure you've all heard about that medication. That's one of the most commonly prescribed oral medications for type 2 diabetes. And the way that works is by slowing down the release of glucose from the liver. And it also helps with insulin resistance. So if you take the standard metformin, it's usually taken 2 times a day, the first dose in the morning with breakfast and the second dose in the evening with dinner. I've have heard something to ask your doctor about is that sometimes metformin can be given at bedtime to help with the dawn phenomena, so a little bit later. But it is best to take metformin with a meal or snack because it'll help with preventing stomach and bowel side effects. If you take extended release metformin, usually that's taken once a day and it should be taken at nights with dinner. And that can also help treat your high blood glucose levels overnight. Okay. And I like to explain this dawn phenomena and insulin resistance because some people think they should be able to manage their diabetes with just their food or exercise habits. And sometimes you can, but sometimes medications are needed to treat the insulin resistance and dawn phenomenon, right? And I just always want people to know that you're never a failure if you cannot manage your diabetes without medication. It's just the nature of diabetes. Meds are usually needed at some point, and sometimes eventually more meds are needed as time goes on, and that's okay. The main thing is to keep your blood glucose within a healthy range to prevent the complications of having a high blood sugar over long periods of time. Okay. There are a couple of other reasons that may explain high blood glucose in the morning, but these are much rarer, so I will just say a bit about them. The Subooha effect, which was named after a chemist who was first to describe in the 1930s, it may occur in people who take insulin, injected insulin. If you take too much insulin in the evening, or if you eat less than usual, your blood glucose may actually fall too low overnight. And your body, remember that liver warehouse puts out more glucose in order to compensate for this low blood sugar, and you might wake up with a higher blood glucose. And the treatment for the Subooha effect usually means adjusting either your food intake or your insulin dosage. And I just wanted to show you them side by side. I just thought this was a really good visual. So you can see here that both the dawn phenomena and the Subooha effect cause elevated blood glucose levels in the morning, right? You can see here's dawn phenomena, high blood sugar in the morning, Subooha effect, high blood sugar in the morning. But the big difference here is in that with the Subooha effect, blood glucose goes low overnight. It dips during the nighttime hours, and then you have that rebound high blood sugar, which the dawn phenomena, it's kind of, steady throughout the night, but it's those hormones in the morning that raises blood sugar. So you can see why it's so important to know the root cause of that high blood sugar in the morning, because you would not want to treat the Subooha effect by giving more insulin. That would just increase the likelihood of blood glucose dropping down during the night. Okay, so this is the reason why your doctor may ask you to test your blood sugar in the middle of the night. Around 2 or 3 in the morning is usually when they would have you check for several nights to determine whether you're experiencing that Subooha effect, the low blood sugar versus the dawn phenomena. Okay. And for those that take insulin, another reason you may experience higher morning glucose levels is because your injected insulin just wears off. If your body does not have enough insulin during the night, your glucose levels might start to rise. So you need to discuss this with your doctor or endocrinologist. You may just need an adjustment in your insulin dose or the time you take your insulin or your insulin pump settings. Okay. So in summary, I hope you will prioritize your sleep, try your best to keep consistent sleep hours, practice good sleep hygiene, and seek sleep consultation and sleep studies when needed. And I just wanted to end by just sharing too that I do meal planning for diabetes classes once a month via Zoom, where I discuss so much more about nutrition and diabetes and how to prevent blood glucose spikes. I would love some of you to join me there. So they also tend to be small groups where it's interactive. I don't record it. You can show your face if you like, and you can ask me your nutrition and diabetes questions. So this is just the schedule, but you can go on the Capitol Health Events website, and these are just other programs that we offer as well. I do the Speak with the Dietitian, but we have a wonderful nurse diabetes educator, Laura, who does the other support group and prevention classes and talks more about medication. And all of these are free. So I just wanted you to know that there's lots of support for people with diabetes here at Capitol Health. And I think I'm completed what I wanted to say. I hope you have a relaxing rest of your evening and that you have a very restful night's sleep. And I welcome your questions. And I think I'll stop sharing so I can see.
Well, thank you very much, Mindy, and to Dr. Zafar as well. Does anyone have any questions? You can take the phone, your Zoom off mute, or you are welcome to type it into the chat box. While we're waiting, I did have a question for Dr. Zafar, and clearly we all underestimate our need for sleep. One of the issues I hear a lot from people is it's hard to quiet the mind, and they talk about, I've heard recommendation of listening to meditative music. So there's things that are, I think, called like alpha waves, delta waves, binaural beats. Is there a recommendation of like how someone can quickly calm the mind and fall into that rhythm to get to sleep?
The short answer is no. So the way you sleep is the way you live. And people often tend to think that there's a distinct difference between daytime and nighttime function. And that's not true. If your mind's constantly going throughout the day, your mind is going at night. So techniques for quieting the mind, as Mindy had brought up, box breathing is a great technique. Diaphragmatic breathing implemented with box breathing is more powerful. A lot of people, when they take deep breaths, will do intercostal breaths where they're taking a deep breath, pulling their shoulders up. That's actually activating the fight or flight system. So learning to breathe properly using the diaphragm, silent breathing through the nose, breathing in for a count of 4. The exhale, the longer it is, the more powerful it can be, but that takes time and practice. From a physiology standpoint, the inhalation process is actually activating fight or flight or the sympathetic drive. Exhalation is activating parasympathetic, which you could simplify and say it's rest and relaxation. So sleep is a process where you need to feel safe, where you can simply just inactivate. The hyperarousal state, in part, is activating a lot of those wake-promoting neurotransmitters, particularly noradrenaline and epinephrine. But some of the other ones may be involved as well. It just depends on each person's wiring and what's firing in the brainstem. So there is a lot of data showing that prayer, mindfulness, meditation, yoga, integrating the breathing practices, increase the connection between the brainstem and the cortex, the frontal cortex specifically. So the more you practice this during the day, the stronger that pathway is. And the stronger that pathway is, the easier it is to activate it in the evening or in the middle of the night, if necessary. But it's not something that will quickly happen. That's why people come and ask for medications. The problems with the meds are, as life stressors escalate, the neurotransmitter levels increase and the med doesn't work as well. And then you're going in a recurring cycle of taking more medication, higher dosing, which then leads to side effects, or the medicine just stops working. So no, that being said, there are people who will find that some things work for them. Putting a fan on, listening to the television, as long as you cover the TV, you're not exposed to the bright light, not engaging with it. Listening to something with headphones. Vagus, which is the main parasympathetic nerve, actually has fibers in the ear. So sometimes putting the earplugs in not only dampens the environmental sounds, but it also activates the parasympathetic system.
Okay, thank you. And I see we have a question. Would regular AM fasting help with big levels?
Would say that would regular AM fasting help
AM
with?
fasting help with big levels? And I'm going to guess that that's high glucose.
Oh, okay. So I know intermittent fasting is kind of a big thing that people ask me about a lot. I mean, there's studies that show that when people that have diabetes eat breakfast, and especially when they include protein at breakfast time, that their blood sugars are actually better not only after breakfast, but even after lunch and after dinner. Okay, so I usually encourage, I mean, everyone's different, and I always say you have to experiment and see what works best for you. I've also seen in my practice and through reading research too, that oftentimes when people don't eat much during the day, when they're those meal skippers at breakfast, sometimes even lunch, that they tend to be the ones that eat more at nighttime. It's kind of a combination of metabolic, when we feel restricted, we tend to want to eat, and just needing, trying to meet our needs. So I always want people to plan regular meals and to have balanced meals. So again, include the protein and carbs, doesn't have to be large meals. Listen to our bodies, when we're hungry, that really is our body's signal that we should eat. We need to fuel our body. Try to do other activities when you're not truly hungry. And, most people get hungry between 3 and 5 hours. So depending on what you ate before and how active you are. So I always say, listen to your body's cues, but it all our eating habits, right? I think that's the one thing that I really learned from researching this, and that, sleep and our eating is also related to the circadian rhythm. And we really were created to eat during the day and, not at night. So I think that's the key. I don't know, did that answer that question?
I think so. And one last question that I have is, my father's an 84-year-old man whose sugar level drops every night. The alarm goes off between 3 to 4, where he has to get up because it's too low, and eat peanut butter. Is there, you talked about people who have the rise during the night. What about people that do the opposite and drop through the night?
Right. And I'm curious if it is around that 3 o'clock time. I mean, it's possible that he might be experiencing that Subooha effect, but then if he does wake up then, so it's not like he stays sleeping and then he wakes up and it's high in the morning. It's just
because the alarm's going off.
Right, because he has the
The sugar's too low.
The meter. Yeah, so with that, I would say a couple of things. It might mean that he needs a snack before bed, that he needs something to hold him throughout the night. And again, I still would include something with some carbohydrate and protein, like some of the examples I gave. But I would also make sure you are having that conversation with his doctor or endocrinologist, because I don't know if he's on insulin. My guess, if it's going low during the night, he is. So he probably needs an adjustment in his medication. It could be, usually that long-lasting insulin, either the Lantus or the it's called. But I would have that discussion with his doctor, because you don't want that to be happening. I mean, he's lucky he has the alarm to wake him up.
Terrific. Any other questions? Well, I want to thank you again, both of you, for a very, very informative evening, and certainly drawing the correlation between sleep and our bodies and the sugar, and they truly are correlated. Mm-hmm. So I thank you both. Have a great evening. And to our guests, thank you for participating.